This winter, more than ever, with COVID-19 still circulating, we need help to reduce all avoidable risks. You can help protect the NHS, social care and loved ones by getting the flu vaccine. You may be eligible for the free vaccine at your GP or local pharmacy if you are over 65, pregnant or have a long-term condition. Find out if you are eligible at nhs.uk/staywell. Children up to Year 7 can get the free nasal spray at school or through their GP if they are below school age. If you are not eligible for the free vaccine, you can pay for it at your local pharmacy. The flu vaccination does not give you flu. It reduces the risk of catching flu, as well as spreading it to others. If you had the vaccination in the past, that will not protect you as the flu strain changes every year, so you need to have a new one this year. It is also important to wash your hands often with warm water and soap. Use tissues when you cough or sneeze, and bin used tissues as quickly as possible. Thank you for helping to protect yourself and loved ones this winter.
I can really recommend being a foster carer for Notts County Council. There's always someone walking the journey alongside you, whether that's other foster carers or social workers. It really helps to provide stability and consistency for children who really need it, and that's really rewarding as a foster carer.
Roger and I have been fostering for 35 years. We do deal with challenges, but to say we've been doing it for 35 years to me proves that it's not impossible. We learn an awful lot from these young people, and even now we're still learning.
As a foster family, we care, we want to make a difference, and we get so much fulfilment from fostering. The satisfaction of making a difference is something that money can't buy. Just seeing the smiles on the children's faces and helping them reach their potential is wonderful.
We work as family workers within the fostering service for Nottinghamshire County Council.
I really enjoy my work. I really enjoy meeting lots of different foster carers.
You know, we get to know the families, we get to know the kids, and we care, basically. It's important as it is to them that the kids are getting the support that they need.
A lot of people said to me they would like to be a foster carer, but there's something stopping them. I had that as well. And we decided just to jump in and do it and see what happened. And for us, it's been the best decision we've ever made.
It's been a fantastic decision, it really has, yes.
Once people start to become a foster carer and take that leap to do it, they'll understand how much it gives back, not just to the child, but how much it empowers you as well.
I'm Leon, I'm a care leaver, and I've been in care since I was 8. I've been with the same parents since, and they're amazing. Like, they are my foster parents, but I do class them as my parents, my mum and dad. All a child wants really from a family is to be supported, loved and cared for, and know they're there because they're wanted. From personal experience, I know the difference it's made for my life.
We always say that we foster as a whole family. It's not just us who are the carers, our children are involved in that. And even now, people express concern about the effect on our birth children of foster caring. I think we need to kind of get past that and dispel that myth, because actually the overall effect on our children, I think, is positive. They're learning new skills, they're gaining empathy, they're interacting with children from different backgrounds. For a long time we didn't make use of support care, and we wanted our child to settle into our placement and not feel pushed out, but it's actually been really helpful for us to start to have support care.
We've known Zoe for a number of years, and it's meant that we got to know her foster child. So for her, it's been like coming for a sleepover rather than a feeling she's coming to another family. I got into fostering for Notts County Council, and it was something that I've always wanted to do. But working full time and my husband also working full time, we thought it's not really going to be something we can do now. But after looking at the website, we realised there was this wonderful thing called support care that we were able to offer. It might surprise you, but actually I'm under 30. I don't have any children of my own, and that doesn't stop you from being a foster carer.
I think some people don't go into foster care because they think it's going to be really costly to have another child living in their house, but actually the fostering allowance is generous enough to cover all the costs of having a child living with you.
We have a lot of fun on the weekends when we have foster children in. We get to go to parks, ice skating, children's events, trampolining parks like I Jump.
We get access to the Max card, which is a discount card for foster carers and their children to access different local amenities. Also recently we went on holiday and we were able to use the Max card to get free access to some castles and historical places because it's a national initiative.
We chose to go with Notts County Council because of the support care that was offered and the training. And it's always local to Nottinghamshire. My parents are foster carers for an agency and they found it really difficult to get support care for their child.
My name's Lynn. I am now a support foster carer. We were mainstream carers, but given our ages, we felt that we couldn't commit to children for long terms anymore. We just find it really rewarding, the relationships we build up with these young people, and we feel we're perhaps a bit like grandparents to them. With the children coming here for weekends, this enables their mainstream carers to have a break, and this makes things more secure perhaps for the children to continue there. I work with my supervising social worker to sort out the dates. She comes out to see us every month and it's all very relaxed. I find Robin really easy to speak to. She listens to my concerns and I value what she is saying to me in return.
The benefits of a supervising social worker are always having someone to contact. There is also emergency duty team that they can contact on a weekend and out of hours. I think the times that it gets difficult is when, she's supported a child for a long time and then they're either moving on out of area or they're moving on because they've reached the age of 18, and she has to say goodbye to that child, so that can be always emotionally draining. Generally it's staying in touch so they know that you do care about them and you are concerned, that the impact that something like that has had on them.
You do feel fully supported. It's like working in a team. We still even now go on training sessions. I almost look forward to those sessions because you meet other foster carers there and it's very interesting. I've always fostered with my husband, who's brilliant, and I feel personally I couldn't do it without him. He's super with the kids and it's just something we continue to enjoy doing. A lot of our friends feel at the ages we are, we shouldn't be doing it, but it's a way of life for us now.
I'm Mark, I'm a foster carer daddy in the family. I'm the fun dad, if you like. I'll try to be anyway, try to be.
And I'm Amy, a foster carer. So we have 4 children of our own and then we foster younger children into our family. Being a foster carer is a devastating privilege. It's devastating that children have to be in this situation, and yet what a privilege that we are able to help them.
Yeah.
When you foster as a family. I think it's very important that everybody in your house is involved, and even though we have 4 children of our own, we don't find that a challenge, we find that quite an easy thing to do. Daniel particularly, he's older and he sees more and he understands more because he's older, and he feels that it's given him an insight as to when he's older and he has his own children. Whenever a placement ends, we always ask them, do you want to do it again? Would you like another child? And it's always yes. And even though we've had the sadness maybe of a child leaving, and they are sad when a child leaves, the positive that we get out of it, they get to see, as we do, the happiness when a child leaves us, and that inspires them as well to want to do it again and again and again, as well as us.
When a child leaves, it's sad for us, but it's happy for them.
The biggest thing for us has been the support network, because if it wasn't for them, I don't think we would be able to carry on. I think it's a big thing to know that there's always someone there if you've ever got problems. And for our children, they really enjoy the events that we attend. We've been quite surprised at actually the amount of events there are.
Barbecues.
Welcome again. Agenda item 1 is the minutes of the last meeting. Any matters arising from the minutes, please raise your hand. If not, if we're all happy to accept the minutes of the last meeting. Thank you all very much indeed. Apologies for absence, Martin.
Thank you, Chairman. So the apologies I've received are from Kevin Dennis from the Police and Crime Commissioner's Office, and from the CCG, Lucy Dadge, Ian Bartholomew's and Fiona Callaghan. And we have Hazel Wigington substituting for Fiona Callaghan.
Thank you, Martin. Agenda item 3, declarations of interest by members, officers, disclosable pecuniary interests or private interests. Joyce, Councillor Bosniak. Joyce.
I'd like to declare a private interest in agenda item number 6, Chair.
Thank you, Councillor Bosniak. The safeguarding one. Any other people got a pecuniary or private interest? Oh,
Chairman.
Oh, Glenn, sorry, Councillor Guilfoyle.
Yeah, I'd like to declare a private interest. I knew the affected adult in the case, and I did support the family in my role as a councillor. I have sought legal advice, and I don't feel I have a substantial interest that would require me to leave the meeting or not to participate.
Thank you, Glenn. Thank you, Councillor Guilfoyle. Thank you. Any other? No, thank you very much indeed. We move into agenda item 4, which is the Chair's report. It's quite a lengthy report, mostly delving into the effects of mental health, etc. Some issues that we're going to be addressing for the future to come. I don't think anybody's got any matters arising from the Chair's report or any questions to ask, please. Councillor Guilfoyle.
Yes, Chairman. Chairman, mine relates to, in particular, the items on page 11, the 20 and 21, 22, 2023. So it's regarding the money that's been allocated for community champions to work with the local community around the issues of COVID. And I just wondered whether we could have at some point some feedback in relation to that. There is a concern, as you know, that we've raised both in full council and at other committees regarding the BAME communities and how
Yes.
they are possibly not coming forward to get the injections, and this money is part of putting people there to be able to encourage them to come forward and get the vaccinations. And I in particular, as last night I watched that programme that was on BBC One, which I would urge all people to look at, is the issue about why is COVID killing people of colour. And it was a really, I mean, although interesting, it was also a very big eye opener for me on that particular situation and the links to poverty as well. So, but I think that's a substantial amount of money for both districts, and I know a lot of good work is being done by both districts. But I just wondered if we could have a report back on that. If Wellbeing.
Yes. Thank you, Glenn. We need a breakdown of what's happening. It's £170,000, and the programme was good, Glenn. It was. I can see we're rolling it out into mosques, etc. The vaccination and trying to reach people, but it's still a challenge. It's still a challenge. Councillor Bosniak, Joyce.
Well, clearly I'd support what Glyn and yourself have said, Chair. I would like to see how that money is being spent, but I'd like to see how effective it is as well.
Yes.
You know, what is it that they're doing that is successful that we can't replicate it elsewhere? So I want to learn something from that investment, I suppose. And then the other thing for me is on page 13, where we talk about Your Health, Your Way Syrian pilot scheme that's in Newark and Sherwood. Well, I'm aware that there's Syrian refugees in Mansfield, and I just wanted to know whether there was any working with them. And because this is about nutrition, mental well-being, and physical activity, presumably the vaccination and COVID will come into that discussion as well. Yes. So I'd like to see how the community COVID champion, is that what they're called? Yeah, community champions about COVID, how they would then interact with this pilot project, and rather than just it being nutrition and mental well-being, but also about all that discussion and debate about COVID. But I suppose my question would be, is Mansfield involved in that? Because I do know there's a Syrian refugee group in Mansfield.
We've got the same in Ashfield as well, Joyce, so it needs to be. So I'll find out the answers to those and get back to you. And the same with that, Glenn. It's a good point. We need to know what's happening with the money and the effect it's having, and if it is being effective. Thank you, Joyce. Any other matters arising from the Chair's report, please? No, thank you very much indeed. I think it's just for noting, actually, consider whether we've got any issues that need raising, which we've done. So agenda item 5 is the breastfeeding update. Can I ask Tina? Tina, are you ready? Tina Buddeer, to give us an update on where we are. Thank you.
Thank you, Chair, and good afternoon, everyone. So today I'm going to give you a bit of an update on the progress, prevalence and targets for local breastfeeding rates and the Breastfeeding Friendly Venues Initiative in Nottinghamshire. For presenting this paper, which I think you've all had sight of, I'm keen to share just some of the highlights. Firstly, this paper is intended to give an annual overview from 2019 to 2020 of both the service and the data of the county. It's important to note there has been a significant gap since the last update for both these areas. So there have been a considerable number of changes and developments. And also for this reason, historically, both these papers were actually presented separately because it has been a while. It's been decided that we'll do it jointly. But to provide more detail and information, I have included a breakdown of data in the appendix as well for your information. So firstly, just to give you a bit of a background in terms of the paper initially presents the facts on the benefit. I'm so sorry, is anyone else getting that feedback?
Yes, Tina, yes. I think we're all getting the feedback.
Oh, okay. I'll just try and plough through that.
I believe Martin's on the case.
Okay, fab, thank you. The paper initially presents the facts and the evidence on the benefits of breastfeeding for both mother, baby and wider. And it's this evidence that drives our work in public health. So the World Health Organization, UNICEF and the UK government recommend that all babies should be exclusively breastfed for the first 6 months of their life for it to achieve optimal growth, development and health. This is noted as a minimum, and that mothers can choose to breastfeed longer or as long as they or their baby require. And equally, those benefits can continue to be gained as well. Breast milk is the ideal food for infants. Firstly, it's free, it's safe, it's clean, and it contains antibodies which help protect against many common childhood diseases and provides all the energy and nutrients an infant needs in the first few months of life and beyond. Evidence also suggests that breastfeeding has a positive impact on both mother and baby relationships by building a strong physical and emotional bond, of which the area of parent interaction and attachment is one of the priorities as part of the breastfeeding strategy, which is where breastfeeding itself as an agenda is feeding into. Evidence also suggests that it helps to improve educational achievements and reduces social inequalities. There is increasing recognition that a part that socioeconomic disadvantage plays in infant feeding. So women from lower socioeconomic groups have lower rates of breastfeeding. And this is definitely a pattern that we see in the county. Although we're seeing an overall increase in breastfeeding rates year upon year, which is great, there's still a variation between districts. So it's really important to note. This has been built into national policy with the provision of additional funds for maternity service to support the UNICEF UK Breastfeeding Friendly Initiative, which I'll talk a bit more about, but it targets low income areas. In 2012, UNICEF UK undertook a cost analysis of the impact of breastfeeding. So this is some of the wider things. Using only few of the illnesses where breastfeeding has shown to have a protective effect, it's revealed that moderate increase in breastfeeding rates could result in potential annual savings for the NHS for around £40 million a year. The true cost of this could be a lot wider, and considering the wider public health agendas. So that's just a bit of a background in terms of some of the key points around the evidence. Just to give you a bit of an update on the data for 2019 and 2020. In relation to locally set targets across the county, we've seen, like I've mentioned before, we've seen a general increase in breastfeeding prevalence. So there are two key stages at which breastfeeding prevalence data is collected. At birth, or what's called initiation, and at 6 to 8 weeks, of which prevalence at 6 to 8 weeks after birth is a key performance measure within the Nottinghamshire Health and Wellbeing Strategy, Best Start Strategy, and the Public Health Outcomes Framework for England. So just to give you a few numbers, and just to note that I have given more detailed tables and data and graphs in the appendix as well, if you prefer kind of the visual aspect of this. But breastfeeding initiation prevalence for 2019 to 2020 in Nottinghamshire was 68.39%, which exceeded the local target of 64.5%. So this equates to approximately 5 more mothers per month per district to breastfeed at birth than compared to the previous year of 2018 and 19. So when considering prevalence at 6 to 8 weeks for 2019 to 20, in Nottinghamshire was 44%. And again, this exceeded the local target, which was set at 42.5%. Now, although we've seen an increase in the last couple of years, a somewhat modest target has been set at 45%, so only a 1% increase for the year 2021. And this is understandably taking into consideration the potential short-term and long-term impacts of COVID-19 that we've already seen impact the service. One more key point to highlight is that although we are seeing an increase in the county, there's still huge variation in districts. So as I mentioned, although some districts do really well in terms of that, and we are seeing various increases in the districts which had historically lower breastfeeding rates, but there's still that huge variation. When looking at the breakdown of the data quarterly, although in quarter 2, which would have been the quarter before Christmas, we saw a drop in breastfeeding prevalence at 6 to 8 weeks. We then saw an increase in the following quarter as a result of lockdown. This is a pattern we have seen throughout the whole year of the pandemic, where when we've had periods of actual lockdown, we've seen breastfeeding rates increase considerably. And we think this is because of the opportunity for mothers, families to stay at home, have that time with baby, and maybe not have external pressures in the same way. Equally, though, the restrictions have also resulted in the reduction of face-to-face support that many women would have normally received. And this has had an impact on mental health and emotional well-being, which we've had considerable amount of anecdotal evidence from our infant feeding coordinators who work directly with mothers. So what they have done is commissioned a lot of online and remote services to make sure that families have had some form of access to support during these difficult times. On a positive note, through COVID, and this was some really good news during COVID, was a significant highlight last year was the UNICEF achievement by the service. So the UNICEF UK Baby Friendly Initiative is an evidence-based stage accreditation programme. and it supports maternity, neonatal health visiting and children's centre services to transform their care. Support is provided to implement best practice, and then an assessment and accreditation process takes place to recognise that they've achieved the required standard. And in May 2020, Nottinghamshire Healthcare NHS Foundation Trust achieved the BFI Gold Sustainability Award, which is not an easy award to achieve. This is really significant for the team. It demonstrates that local healthy family teams, as part of the NCC commissioned Healthy Family Programme, have effectively embedded the achieving sustainability standards into practice. The award is a recognition that the service is not only implementing standards, but they also have the leadership, culture and systems in place this over the long term. And this is something, once they've achieved it, it is something that they have to continuously evidence to make sure that they are adhering to the standards that they've been recognised against. So in terms of developments going forward, the Nottinghamshire Healthcare Trust will maintain the Sustainability Award, as I've mentioned, by consistently evidencing the high level of service being offered. We will have breastfeeding peer support services, which will continue to be provided as part of the NCC Children's Centres offer, although this is currently on hold due to the COVID restrictions, but we're hoping to resume this this September. And we're also hoping to have increased support, which we aim to be offered by the breastfeeding support workers or infant feeding coordinators on the postnatal wards as the hospital trusts. So that's a bit of a background and a bit of a run through around breastfeeding. I just want to give you a bit of an update on the breastfeeding friendly initiative around breastfeeding friendly venues. So just to give you a little background on it. It was launched in Nottinghamshire in February 2015 and aims to support mothers to be able to comfortably, safely breastfeed in public places. Breastfed babies need to feed frequently and on demand. And mothers, particularly younger mothers, have cited fear of breastfeeding in public as a barrier to continue to breastfeed. So when we have breastfeeding rates taken at 6 to 8 weeks, the reason that's so significant is because that is one of post 6 to 8 weeks is often when we see a drop off because it's hard to that consistency to maintain. So having these offers in place to support young mothers is vital to help them continue in their breastfeeding journey, at least for that 6-month period. It's important that mothers feel comfortable to be able to breastfeed anywhere, and this is where this programme plays a huge part in that. District councils provide support to enable organisations to apply to become breastfeeding friendly venues. Venues are given information and advice on defined standards, and in order to meet when they meet these standards, they gain an accreditation and are classed as a baby friendly or breastfeeding friendly venue. The accreditation assessment is carried out by the trust as well. And organisations that sign up to be breastfeeding friendly are asked to adopt a positive friendly approach, which could include providing a clean, comfortable environment, ensuring that they are supported in case they need a suitable clean area to breastfeed in. A mum can identify that this venue has received this accreditation because the venues are asked to display a till sticker and a sticker in the window to show that they've been part of this process. In 2019-18, we had over 200 venues achieve this standard, which is fantastic. However, obviously, because of the restrictions implemented as a result of COVID-19, meaning that many venues have closed, and as such, we've not been able to develop this further, and many venues haven't been able to gain the re-accreditation. We are hoping as soon as venues start to open up again, and as soon as it's COVID safe too, for our volunteers, to be able to get this up and running again. So in terms of our recommendations, in terms of what we're asking from members, and again, looking at both areas separately. So with respect to breastfeeding, firstly, to note the information shared in the paper in relation to breastfeeding activity and data in Nottinghamshire. And secondly, to consider the role of the board can play in supporting the promotion of breastfeeding locally, with a particular focus on increasing the proportion of women breastfeeding at 6 to 8 weeks. And thirdly, to continue to support in driving and implementing the local breastfeeding action plan to improve breastfeeding prevalence, specifically targeting areas of county with the lowest rates. And then finally, when considering the Breastfeeding Friendly initiative, we ask partners to support the expansion of the breastfeeding friendly venues in each district in conjunction with Nottinghamshire County Council, obviously when it's COVID safe too. And secondly, to ask district councils to continue to drive and monitor the implementation of breastfeeding friendly venues in conjunction with Nottinghamshire County Council. So it's a bit of a run through. So I'm welcome to take any questions, Chair.
Thank you, Tina. Questions, please. Susan. Susan Shaw. Good afternoon, Susan.
Hello, thank you, Chair. Thank you, Tina. That was really good. I just wanted to say that in Bassett Law we're fully supportive of the recommendations, but also the work we're doing in Bassett Law. When we started, we made sure that the district council officers, both at Worksop and Retford, were doing that first because there was lots of people coming through the front door. Yeah. So we did that, and then we've been promoting it across the district. We had lots of really good photographs and promotion of that. Of course, as you say, it's come to a bit of a standstill, but we're committed, and we've got a member of staff to move this forward as soon as possible. So I just wanted to share that with you. Thank you.
That's so positive to hear. Thank you, Susan. And we can definitely see the benefits, because obviously we're seeing the breastfeeding rates in Bassett Law increasing as well. So it's really positive. Thank you.
Thank you. Jonathan, is that your hand up? Oh, Neil. Oh, sorry, Neil.
Thank you, Chair. Yeah, so say thank you, Tina. It's a really good report, actually. It's a positive report, but it's acknowledging the difficulties we're going through at the moment.
Yeah.
Newark and Sherwood are definitely. I remember one of the first things I did when I was actually a councillor at Newark and Sherwood back in 2015, I think, was actually to make Newark and Sherwood a breastfeeding friendly. All their buildings breastfeeding friendly environments, as well as pushing it out in the district. But I think what hit me whilst you were reading your report, shall we say, was now more than ever it's important we get the message over, not just to expectant mothers, but to society as a whole.
Yeah.
The importance of the health benefits of breastfeeding for young children. The first 1,000 days is so important. I've got a vested interest, really, because my wife works in maternity services, so I'll have to just mention that. But I know from what she said about how difficult it is, especially postnatal. There are volunteers that go into most maternity units who are trained counsellors to help with breastfeeding. I was looking at the rates of the drop-off, which seems all very familiar after 6 weeks. And 6 weeks, we should be looking at 6 months a year, 12 months if possible, for the maximum benefit. But I think if the pandemic teaches us anything about public health, the importance of a good start in the first 1,000 days is so important to the rest of all our lives.
Absolutely.
That we've all got a responsibility to actually push this message over to society as a whole. And it's the whole thing about when my children were young back in the noughties, it was really difficult to breastfeed in public in many cases. And we had people coming up and complaining because my wife was feeding them in cafes and things. So we've moved forward so far, but we've got a long way to go.
Yeah, and I think, like you say, this agenda is quite close to my heart. As someone who's got 2 little boys and I breastfed both of them, there are those challenges. And I have to say, I know I shared this in previous meetings, but the infant feeding coordinators that we have that really drive this are absolutely amazing. They've really been really innovative, especially during COVID. I can't speak highly of them. And also, I think they recognise some of the barriers and some of the cultural changes needed in terms of supporting mothers to breastfeed. And, they're doing so many different initiatives that I've not even mentioned in this paper, like working with mothers within districts, in communities, and using case studies and asking them to do video calls and speak to other mothers. So there's a lot going on in the background. Yeah.
Yeah, peer support basically, isn't it?
Yeah.
Thank you, Neil. Thank you, Tina. Jeremy. Jeremy.
Thank you, Tina. Really important, you know, as has been said before, that we promote health, and we promote something that is a completely natural process that is helpful in terms of bonding between mother and child, and optimizes health also. I'm interested from a general practice perspective about the number of venues across Nottinghamshire, whether that be healthcare practices, health centres, hospital units, how much data there is in terms of the number of places that are breast friendly accredited. Because if we're not promoting it in those sort of places, then we've got a fundamental problem.
Absolutely.
So if you have got any information, any data, this should be something that we can work on over the next 12 months, really.
That's actually really useful because it is data we collect quarterly. We do have, I have that data available, so I can happily share that with you. GP practices, health centres. So health centres, they've been kind of more of our initial targets, and I know that our coordinator's been working with GP practices. It's not always been as straightforward as we'd hoped. So to have that support to be able to do that and get practices on board, to get them accredited, would be fantastic. But we have got the data available, which practices are and which aren't yet. So I can definitely share that with you.
Thank you, Jeremy. Thank you, Tina. Councillor Tidwell, Colin.
Yes, good afternoon. We all know the benefits of breastfeeding. Even my grandmother used to know that one. And yeah, we need to keep pushing the best practice. And I know that places like Akershaw's Early Learning Centres have always been at the forefront. Well, they were until 2020, which also brings me on to, it's not just best practice, it's continuity of care. I know that Early Learning Centres have got a fantastic, where we are, there is people who are not exactly well off. They have got themselves established well within the local community, and this is where we need continuity of care as well for breastfeeding, because mothers pass on the information to the families. And that is why I noticed in where Broxtowe had come out quite well, which was surprising when you actually look at some of the poor areas. The other thing I'd like to bring up with it, the breastfeeding friendly spaces. One would hope that tourist information centres as well have this information, so people coming out to Nottingham or places can actually go into, place they don't know, they can go to the tourist information centre. This sort of information should be available for them as well. Thank you.
Thank you, Colin. Thank you, Tina.
Thank you.
Abby, Councillor Brennan.
Thank you. Thank you, Tina. Yes, very good summary of the paper. Very interesting. I know this is specifically about venues, and it is a very timely reminder for us to think about it as venues start to reopen, sort of reminding them of their obligations and their opportunities with regard to this. But my question is about employers, and I don't know whether this is within the scope of this piece of work or this paper, but sort of worth flagging up, because obviously one of the reasons women stop breastfeeding is because they have to return to work.
Sure.
And not all workplaces make it easy or acceptable for women to express or have a quiet space to do so, or to go to the nearest nursery and feed their babies there. It was certainly a reason why I dropped off from breastfeeding, because the workplaces weren't really comfortable or didn't make it feel like an acceptable thing to do. So I'm just wondering if there's anything in here about targeting employers to encourage them to enable women to continue breastfeeding at home once they return to the workplace.
Definitely. So we'd already started before COVID hit, talking about looking at private organisations and franchises as well. So yes, definitely. But also, I think we felt that we needed to start a bit closer to home and ensure that our county council buildings were accredited, considered breastfeeding friendly. So that's something that we were in the process of, and I think a few of them had already been accredited before I think that could have been completed, because we need to be, you know, flying the flag basically for what we're trying to achieve. So yeah, I take your point on board with that completely.
Thank you.
Thank you, Abby. Thank you, Tina. Councillor Guilford, Glenn.
Thank you, Chairman. Tina's probably just stolen my thunder a bit there, because I was going to say, what about county council buildings? Clearly, you know, here we are trying to promote, and it's about that joined up message, isn't it, that we send out. And also, you know, earlier on, tourism was mentioned. What about Rufford, Clumber, and places in particular now? Because although a lot of the premises that we may have got registered currently are closed because of COVID, our open spaces aren't, and that's where you know, we're encouraging people to actually, if they, you know, need to get out into open spaces, keep the distance, but, you know, get some fresh air. And I think that there'd be, you know, some concern by young mums that, you know, they can't do it even in some of the open spaces or some of the places because they might get challenged. So I think we need to look at that as well. I think the other issue for me is obviously, and it sounds it's negative, it's not, is that Bassett Law's done absolutely fantastic in the accredited venues, as Sue has pointed out. You know, they've got a real incentive in getting out there, but the impact in reality, when you look at some of the percentages, it's still not very good, is it? You know, right across the board, you know, we could sort of do better.
Yeah, definitely.
And the correlation, when you look at, because that's what I looked at that figure, those figures. I went, oh, that's interesting. Bassett Law, top of the pops, which is not unusual because we usually are as a district top of the pops. But I looked and I thought, oh, well, how does that correlate with one of the best areas, Rushcliffe? You know, where the demographics completely different, and also, you know, even when you look at lifespan, if you live in Bassett Law, I think it's about 8 years left if you live here as opposed to living in Rushcliffe. But I looked at that and I thought, in reality, that, you know, there isn't much of a difference in how many venues you've got to how well you are actually doing it in the breastfeeding front. And I was also just thinking about the fact that what we're saying is people haven't had that contact with organisations and people as much, and you've been doing more video conferencing. But I thought, actually, in one sense, because mums are at home, I would have hoped to have seen an increase. Because actually, the challenge that they got where, you know, we're out and about and there isn't anywhere, actually, because we've been sort of more staying at home, I would hope, say, the figures as they come out next year would actually show a little bit of an increase, because it's probably took away that particular aspect that mums and the difficulty that mums have sort of have, the privacy, because clearly they've been locked in their own homes for the last few months.
And like I said, we have seen that increase. You know, it was significantly high in lockdown, and as the initial lockdown, as we were coming out of it, we did see that dip. And again, we've been through that, and it's correlated with the lockdowns. So
Thank you. Thank you, Glenn. David Ainsworth. David, please.
Yes, thank you, and good afternoon, everybody. Thanks, Tina. Really good work, clearly, and as always, with everything more to do. And as we move towards health and social care integration of teams across and focusing on place, as we focus on people, teams integrating around the place, clearly the inequality and gaps are clear for us all to see across numerous indices, this included. I just wonder whether we've done enough, or whether we should have an offline conversation around integrating the breastfeeding support workers into the local systems around place and ICP. So I'll have a conversation, Tina, offline, if that's okay.
Yes, please. I would really welcome that.
Thank you.
Thank you, David. Jonathan Gribbin.
Yeah, afternoon, everyone, and thank you, colleagues around the board for the support that's been expressed already, and some of the very specific actions that several of you have volunteered. And I just wanted to pick up then the point around Nottinghamshire County Council, both in terms of our buildings and properties, in terms of their being open to residents and members of the public, and also giving consideration to how our workspaces are configured and made breastfeeding friendly as they start to open up later in the new year. And that's just to confirm, Chair, I'll pick up the action to follow through with my corporate leadership team colleagues on that to make sure that the County Council is also doing its part. Thanks.
Thank you, Jonathan. And thank you, Tina. Any more questions, please? No, thank you very much indeed, Tina. I think we'll look forward to the update and see if we can improve even further. So thank you very much indeed.
Thank you, Chair.
Agenda item 6, sorry, an update on the work of the Nottinghamshire Safeguarding Adults Board.
Chairman, we were all agreed on the actions in relation to this in terms of the
Tina actually read the recommendations, all the recommendations out, Martin. So she read the recommendations to consider information shared in the paper, etc. Tina presented that.
Yeah.
She did, Chairman. I want to make sure that all the boards all agreed.
Yes. Thank you. Yes, she actually presented that. Thank you, Martin. So move on to the update of the work of the National Safeguarding Adults Board. Alan, welcome.
Thank you very much, Chair, and thanks for the opportunity to present the report. Good afternoon, everybody. I hope you're all keeping well during this challenging time. What I am pleased to report is we've actually produced an annual report, because when I look around the rest of the country, quite a number of safeguarding adults boards during the last year have paused what they've been doing and actually not been able to present a report. So one thing I've got to say, very positive for Nottinghamshire, is that we've been able to actually produce our report. And during the last year, we've continued to work as a board, met more frequently to keep an update on COVID, which has been helpful for all partners. But, you know, I've got to say, I find that really positive that we have been able to do that. My view was, whilst the most important priority clearly was protecting people and saving lives as a result of COVID and protecting the NHS, I also felt it was very important that the safeguarding side of things, making sure that those people that are most at risk of harm and abuse are protected. So I felt, you know, continuing the work of the board during the last year has been extremely important as well. As I say, partners have contributed immensely in that. I'm hoping people have had the opportunity to read the annual report. However, we've tried to keep it fairly short and sharp and in plain English, and what I would term a fairly easy read. I understand it, so I always think if that's good, if I get it, Chair, then I would hope most people would get it. Obviously, I don't intend to go through the report that I've presented. Obviously, I've picked out some highlights in there. One of the things I wanted to just touch on, clearly one of the things we have to do in the annual report is report on any safeguarding adult reviews, SARS. We've had one that's mentioned in the report of a young man up in the north of the county, and I think a couple of the councillors may have referred on that in the opening. What I want to say, Chair, is that was a difficult review. We had, in my view, an excellent independent reviewer, but the one thing that stood out was really working with the family. And in previous years, we've not always done that really well. To say, I mean, I went out and met the family at the very beginning to explain the role of the board, the role of the review, introduced the family to a member of the strategic team who has kept in touch with the family all the way through. And they've been really helpful in contributing to some of the lessons and actually wanting to help with a couple of practitioner events that we've had that were very well received. And we've also got a learning event early in June that we've built and used themes from the review to sort of advise us on that. And as I say, the family and particularly mum has been very, very instrumental in helping us work through some of this, you know, bearing in mind the real tragedy behind the death of this young man that the review is about. Another couple of things really I just want to mention. We've been producing a regular e-bulletin that has been very well received by people, and as ever, we're always asking for feedback, things like that. We had good contribution from Health Watch during the year 1920 in helping us to sort of find out from service users their sort of views on safeguarding. I think the rest of it really is in there, Chair, so I don't want to go through line by line, so I'll sort of open it up. Quite happy to take any questions, and if I can answer them, I will, and if not, I'll find out what the answers are.
Thank you.
Over to you.
Thank you, Alan. Yeah, you're doing a wonderful job there, Alan. Any questions, please? Councillor Guilfoyle, Glim.
Thank you, Chairman, and thank you, Alan. And I, just want to place on record how lucky we are to have you as our chair of the Safeguarding Adult Sport. I know your background, and I know how much you care about the job that you do. Chairman, Alan, in reality, it is relating to that, and it to the SAR, and it relates to the recommendation, because obviously I've only just seen when the papers came out and looked at the executive summary, and in the summary it did say that the Safeguarding Adults Board should share the learning from the case with the Health and Wellbeing Board on the issue. And I just wondered whether there is something that, rather than just the report, because when you look at the executive summary, there's issues within that come out. And I know that there is a concern about the held by people about the transition, and that's been raised in committee on a number of occasions. But I also know that there was an inquest, and whether you link the learning points from the coroner's inquest and the SAR together, and whether that is done on any of the other cases, because I think that would also help all organisations in the learning points. I've looked previously to see whether you could, because I don't know how you access any coroner's reports on stuff, because there don't seem to be a thing where you can actually go and sort of search it and get hold of that, although they are held in public. But again, I say, is there anything more that could come to committee so we could have that discussion? And I know I'm still pick up concerns from parents who have children with difficulties, even younger than this case, who have difficulties in accessing the right services, and sometimes feel that the thresholds that are in place make it very difficult. Now, I know there's a lot of good work that's going out there within troubled families and other areas where that all complement this. There's a whole host of services that can come together. But as I say, there are still some concerns, and in particular concerns related to CAMS. Now, I know that in particular doesn't deal with your review, because yours particular is around safeguarding adults. But the issue was that in some respects, I know, was around some of that transitional issues. And I think there's, clarity around that still is not there for me.
Couple of points then, Glenn, and it's good to see you, and thank you for your very kind comments in opening. I personally went to the inquest, sat there two very long days, very difficult inquest. Our sort of process, as you're probably well aware, is that there is an action plan with recommendations in there that goes through I've got a SAR subgroup chaired by Amanda Sullivan. So I'm very fortunate that Amanda chairs that subgroup. I'm quite happy to ask for a little bit more work to be done so that we can produce a little bit more of a detailed report to this board. I'm quite happy to do that. Obviously, the review, as you well know, touched on that transition around childhood to adults, and we work closely with children's colleagues. And I know officers within the sort of children's safeguarding world worked with my adult safeguarding colleagues to sort of pick up on the recommendations. But I'm quite happy to go back to Amanda and the SARSA group to see what we can send to you or what we can produce, in addition to what we've already got, if that makes sense to you.
Yeah, yes, yeah, that would be good. Because I think the issue for me is actually saying, well, yeah, you've learnt the lessons, have they been implemented, and then coming back at a later date to say, right, where are we now? What's the state of play? Because I think that's important, and I'm sure you're doing that. But I think as a board, I think we, clearly the recommendation was that should be shared with us.
Yeah, absolutely, and I'll make sure. Say the plan is monitored through my source subgroup, and I'll ensure that that is followed up and that we're clear on that. I will make sure that happens.
Thank you.
Thank you, Glenn. Thank you, Alan. Jeremy. Jeremy.
Thank you for that. Obviously, very, very important work. It's absolutely vital that we abuse and the impact of issues such as neglect is really critical for the protection of our patient and our population. I just want to talk to you about the care home aspect, and I talk as a GP who sees not infrequently safeguard referrals from paramedics on transfers of patients in the care home sector. I've also had conversations with care home staff about this, and whilst I think it's absolutely crucial that there should be the ability to make referrals where there are concerns about neglect, I do wonder sometimes about the threshold at which those referrals are made. How many of them actually turn into Section 42 cases? And the partnership working between the paramedic organisations and the care home sector in terms of education and learning. Because the care home staff that I've spoken to feel that there isn't really an awful lot of partnership working that's going on in terms of training for the care home staff on the sorts of issues that paramedics may well raise on a safeguarding referral. Now, that may well be part of the role of the home by itself, but I do think there is a window of opportunity there to actually have some conversations between the paramedics and the care home, because whilst acknowledging that it's vital that referrals are made, there can be times when the morale of the care home staff is adversely affected by referrals for safeguarding that ultimately may not have a significant impact on patient care. So it's just trying to see this from a slightly different way. I accepting the importance, but I want referrals going through to Section 42. I want those to be a higher percentage of the referrals that we get, whilst at the same time increasing the absolute numbers. So I'd just be interested in your comments there.
Yeah, a couple of things there, Jeremy. The issue around what I would call a conversion rate, obviously, is where a referral comes in and that turns into a Section 42 inquiry. Those go into the MASH. One of the big priorities for the board is to improve the conversion rate, because I think, as we're saying there, what we want is people at the front end to be within the MASH and in the teams to be actually dealing with what is actual safeguarding and not maybe a quality issue or a minor issue that is not actually safeguarding. Now, care homes, we do have a care home forum, and I'm sure if Melanie's on the call, she would know a little bit more than I do. And I know a lot of work has been done with care homes with regard to training of staff. But I think with the number of care homes there are, and maybe an issue around the turnover of staff could be an issue there. Now, the paramedic side of it, East Midlands Ambulance Service, are one of the biggest providers, if you like, of referrals. The quality is not always brilliant, and I know there's been some work been taking place with EMAS around their referrals, but they are one of the sort of areas of concern for us. The issue, I think, around, you've mentioned, Jeremy, around the partnership working. I'm not picking that up, and I have to say, during COVID, I've moved from quarterly meetings to monthly get-togethers to actually find from partners what the issues are taking place and what are the risks, what is the impact of COVID. And I am repeatedly being told good work is taking place with care homes, particularly with the care home forum that takes place. There's been a lot of training of care home staff. So I'm not quite sure what you're pointing out there is what is coming back to me. But I've made a note there. I'm certainly going to go back and ask those questions around, you know, what is the reality there? Because again, going back to your point, absolutely, we want safeguarding issues coming into the multi-agency safeguarding hub, not things that should be dealt with elsewhere. So for me, there's an issue, as I bang on very often at board meetings, around first line supervision and people actually supporting their staff to ensure they understand what is a safeguarding referral, so that the quality that comes to us is the proper stuff to deal with. Now, I don't know if that answers your question, but, you know, I'm constantly asking, particularly about care homes, because, you know, they have sort of raised during COVID, and I'm asking questions all the time about, can you assure me that things are working? Now, what you're pointing out there could well be issues, and I should be going back and asking further questions to find out, you know, what the state really is.
Okay. Yeah, that's very helpful. I guess it's just the partnership, the thing that I'm raising is about between the care home sector and the ambulance service. Okay. In terms of education.
Well, EMAS sits on my, sorry, EMAS are represented on my board, so I will certainly ask that question and find out, you know, the reality and see basically if there is an issue, what they're doing about it.
Yeah, if there's a strategy as well to improve it.
Okay.
Thank you, Jeremy. Thank you, Alan. Councillor Bosnett, Joyce.
Yeah, thanks, Kevin. Just a couple of things. Alan, thanks for the report. I'm just looking, first of all, at paragraph 6. But when I first looked at that and saw that there'd been an increase of 36%, I was horrified. And then I thought, but actually it's positive as well, because in your next sentence you say that this indicates the increased awareness of abuse, which has got to be a good news story. So that's the first thing I wanted to say. But equally, like Glyn, I must raise some concerns about the Safeguarding Adults review that was done. Now, it took place in November 2019, and we now March 21, and this is the first time I understand that the Health and Wellbeing Board have seen it, even though the recommendation says that any learning from the review needs to come to the Health and Wellbeing Board. So I'm disappointed in that, Alan, and I'm sure you'll be able to explain to me why that is. And I think that this board needs to see it very, very quickly, because we want to know that we're not going to be in the same kind of situation in perhaps a year's time. Then, so that's my little grumble. And I also would like to see a little bit more detail about what was in the executive report. I've looked through it. But unless people look through that, from reading this, they wouldn't think it was quite so bad, because towards the bottom or just past the middle where it says, I'm looking now at the yellow pages, which is page 48 of the 64, and it says the SAR found that there could have been better sharing, coordination, etc., etc. Well, I think that should say the SAR found that there should be. We need to, this is about an action. It's not saying, oh, you know, we could have done that better. What we should be saying here is we should have done it better, and we need to do it better in the future. So I think we need to just the report is just a little bit, as the report that you presented to us is just a little bit too nice, and I'd like to see it with more teeth. I'm also concerned as well, and I'm not surprised by this, is that when you have someone with autism and a mental health problem, it falls between two stools, and I think people specialise in their own bit without seeing the relationship between two, and because this young man had autism, it was almost as though the mental health problem was ignored, which I don't believe to be the case. But I'm just saying that when you have people concentrating on their sphere of specialism, they don't necessarily see the whole picture. And that's not just peculiar to this one incident. It's a similar thing when you see people who go into a medical setting in a hospital, for instance, who've got dementia, and the staff who don't know how to deal with the dementia. So I think it's not it's not the first time I've seen this, but I do think that this, for anybody who's not seen the executive summary, I suggest you have a look, because that gives a slightly clearer picture and slightly more detail. So Alan, I'm looking forward to seeing it come back as a proper report on the learning that took place as a result of that particular review. Thank you.
Thank you, Joyce.
Chair, if I may just respond then. Firstly, touched on Councillor Bosniak, the rise. Yes, we've mentioned increased awareness, but what I will also point out, the CARE Act brought in some additional sort of components for referrals, as in self-neglect, sort of domestic abuse, modern day slavery, which were things that weren't previously reported on. So I think, again, that sort of reflects possibly the increase, this widened sort of cohort, if you like. I apologise that it's not been to the Health and Wellbeing Board before, maybe an oversight on our part, but I'm not sure during the last year we've had an opportunity to bring it there. I don't know if I'm wrong there. I don't recall having been requested to come along and bring it during the last 12 months because of COVID. I may be wrong. I don't know whether that is why we've not brought it before, but I will find out. The SAR, as I'm sure you'll appreciate, Councillor, went through a very, very thorough, rigorous process, as I say, including the family at every stage. It went through my SAR subgroup, who are the people who sit there with Amanda Sullivan as the chair and experts in their field. It went through backwards and forwards, so to speak. I don't mean to sort of play that down, but it went for checking, rechecking, and the group were very, very confident with speaking to the family that, what was in there was, considered appropriate. Now, I'm picking up on your comments. It may be, Councillor, out of this meeting, if you'd like maybe to speak to Amanda or Melanie, who could give you maybe a little bit more sort of detail that you're looking for, but all I can sort of report on is a very, very rigorous process, working with the family at every stage. Yes, the recommendations are being followed through the board process, and I will making sure that I'm assured that things are done. We are having that learning event. And again, picking up on Councillor Guilfoyle's comments earlier, I think we need to make sure, and I will make sure, that a more detailed sort of report comes through.
Thank you, Alan. Colin, back to you. Oh, sorry, Joyce.
Could I just say before we move on, Chair, I don't doubt for 1 minute that rigour didn't take place. So, Alan, please don't think that, I think that you're not keeping an eye on these things, because I know that you're doing a cracking job. It's the fact that it didn't come back to us in a timely manner.
Thank you, Joyce. Colin, back to you.
Thank you, Chair. And I listened with interest, and I have to remind myself, actually, as Martin Gately reminded me at the beginning of the meeting, before the start of the meeting, unusually for committees or boards, as Corporate Director for Children's Services, as Melanie is as Corporate Director for Adult Services, and Jonathan is as the Public Health, we're actually members of the committee and members of the board. So this is a little bit unusual for me, rather than being at a Children and Young People's Committee, where I'm clearly there as an officer rather than a member of the committee/board. I was listening to the conversation, and thinking, which is all I'm going to do is to share my thinking as to the relationship between the Health and Wellbeing Board, the Safeguarding Adults Board, and the Adult and Social Care Committee, as to the roles of scrutiny, of a report, either of the individual case or the annual report like this, and understanding better as to ultimately where that scrutiny role lies. It's an observation and a reflection, I guess, Chair.
Thank you, Colin. Alan, I think that's more of a comment more than I don't think you need to answer. Councillor Shaw.
Yeah, thank you. Thank you for the report. I just wanted to follow up on a couple of things. Well, I had on my list about bringing it, the timeliness of bringing it back to Health and Wellbeing Board, which has been articulated, so I don't need to say anything more about that. I was just following on from Jeremy's comments, because what I'd listed down from reading the report was the care home forum. Does that include residents on the forum? I'm just interested in that. And because of, I wanted your observation between 2021 and COVID, where loved ones haven't been able to go into care homes, and so therefore they haven't been doing the checks on their loved ones as they would do in normal circumstances. And you said you'd had monthly meetings with colleagues, all saying that everything's rosy in the care home world, and I hope it is, I'm sure it is. However, you haven't really got independent, well, via friends and families and loved ones going in to check their loved ones. And I was just interested in what your views were about what may happen in 2021 going forward and what you know already. But I also wanted to say that what Jeremy was saying about EMAS and people putting in safeguarding referrals when it probably wasn't necessary. Maybe in this transition of COVID, it was a good thing that people were putting them in. Now, maybe in some cases it was wrong or it was not appropriate, but isn't it better to be more cautious than not in terms of this year of extraordinary times for vulnerable people? Just interested in people's views on that.
Councillor, if I might pick those up as I think I got them. The care home forum, I'm not sure whether residents are in that, but I will find out. So sorry, I'm not so sure if I sort of suggested things were all rosy. I'm sorry, I've sort of misled you a little bit. I have had the monthly meetings, and I think people have been very concerned about, what's been happening within care homes during COVID. And basically, I've been asking the questions, basically, what are you doing to ensure that, as much as can be done to protect those within the care homes on a safeguarding sort of basis. And the monthly feedback I've been getting is that certainly the county council and the local health sort of people have been working closely within care homes. And I'm not saying that things there have been challenges, but people have been working in a positive way. People have been getting. Going on your point about and what Jonathan was saying around, about Jeremy was saying around sort of people referring things that maybe don't fit safeguarding. I don't think it's a bad thing. If people aren't sure, then yes, I think they should be referring it. In the ideal world, in big organisations, for example, the police, the health services, I would expect that some form of triage is done before it comes into the safeguarding arena. That's what managers are paid for. You get a set of circumstances come to a frontline worker. If they're not sure whether it's safeguarding, they go to a manager who makes it clear for them and they make a referral. I get that in a busy care home or some of the smaller places, people don't always get what exactly is a safeguarding issue. And by all means, refer those in, because it may be and it may not be. But, I would not ever say to someone, if you're not sure, don't refer it. So I don't know, again, if that answers the question there. It is a difficult balance. What I will say is, you know, in partnership land, often a different language means different things to different people. What I am really, I've been really pleased with recently, and most of you in there at your board know that my background is policing. Police officers, sometime even up to recently, would not know what safeguarding is. But I was really delighted to hear that within Nottinghamshire Police, they have a regular safeguarding board meeting chaired by an assistant chief constable. And I felt that was a real up in their game when they've actually got that in place internally. And I think that means, you know, safeguarding is being taken very seriously within that organisation. So, you know, I think the message is getting through.
Thank you, Alan. Any more questions for Alan, please? Jeremy, come back. I think you're on mute, Jeremy.
So I just want to make sure that my points are clear. I understand the issue around threshold, and where there's doubt, then I would agree with you. I think it is important to make those points. But my point is very much around the partnership between the care home sector and EMAS, and the actual mutual understanding about what are the thresholds at which point a referral will be made to a safeguarding to safeguarding. That's the point I'm making, and I think it's all very well having the care home train their own staff on safeguarding, which I expect them to do, but it's not the care home that's going to make the referral into safeguarding. And I think it is important that it is important that we protect the we protect the patients, particularly, as Susan said, at this very difficult time. But it's also important that we protect the providers of care as well. And so actually educating across a partnership, I think, could actually improve the quality of the referrals.
Yeah, and I've made a note of that, Jeremy. Certainly I'll be taking away, speaking to my colleagues around the board, EMAS, the care home sector. But yes, I've picked up on what you've said, Jeremy, and I shall follow that through and get back to you on that.
Appreciated.
Thank you, Alan. Any more questions from the board, please? No, thank you. And the recommendations are that the Health and Wellbeing Board considers the contents of the report and the actions to support the work of the Nottinghamshire Safeguarding Adults Board in protecting adults at risk from abuse and neglect. On a personal note, Alan, thank you very much indeed for all the work you're doing, and thank you for attending this afternoon. You do an excellent job, well regarded and well respected, and keep up the good work. Thank you, Alan. Much appreciated.
Thank you. Thanks very much.
Agenda item 7 is to update us on the launch of the targeted lung health check programme. Simon, I believe you're presenting the report. Thank you.
Yes, thank you. And hopefully you've got a PowerPoint presentation to load up alongside the report that I've submitted. And thanks, Chair, for inviting me to come and update you on the lung health check programme. I'm Simon Castle. I'm Head of Cancer and End of Life Commissioning for the CCG. So I'm just going to go through quickly the slides and then open up for discussion. Next slide, please. So, introduction. Mansfield and Ashfield, we are one of 10 pilot sites across the country implementing targeted lung health checks. £70 million funding for these 10 sites, and for Mansfield and Ashfield, we've been awarded £5.2 million to implement this. And sites have been chosen based on those areas with high lung cancer mortality and high smoking rates, and that tends to be linked to deprivation. There's a clear link between deprivation, smoking, and high lung cancer rates. And the aim of the programme is very simple, to achieve earlier diagnosis of lung cancer and other lung diseases, for example, COPD, which enables us to deliver better treatment options and ultimately to improve survival rates. Next slide. And this is the reason why we're particularly concentrating on lung. I'll just spend a few minutes going through this. So this is looking at the proportion of early diagnosis for each of the main cancers in the East Midlands. So at the bottom, your axes is the percentage diagnosed as stage 1 and 2, which is what we're trying to achieve. And the national aim is to get to 75% of cancers being diagnosed at stage 1 and 2. So we're trying to shift all of these cancers to the right-hand side of the slide. But as you can see, for some cancers, there's some way to go, and lung is one of those cancers that really stands out. It's got low early stage diagnosis, and then the axis on the left shows cancer incidence. So lung cancer is one of the most prevalent cancers that we have. So it really stands out in what we're trying to achieve. And if you plotted Mansfield and Ashfield within this graph, it would be even further to the left, which I'll come on to in a minute. So lung cancer really stands out as a cancer that we're trying to improve diagnosis and survival. Next slide, please. And this slide probably shows that more graphically. This shows the relationship between early stage and survival for Mansfield and Ashfield population. So the green bars show the 1-year survival for each stage of lung cancer. So as you can see, for a stage 1 lung cancer, you're achieving 70% 1-year survival. If you look down onto the right at stage 4 cancers, we're barely getting above 10% 1-year survival. But then when you look at the proportion of cancers and how they're diagnosed, there's an inverse relationship. It's the opposite. Most of the cancers we diagnose, over 60%, nearly 2/3, are diagnosed as late stage 3 and 4. And actually the most common is stage 4 cancer. And I've just identified there the mean survival for a stage 4 lung cancer is 120 days, which is quite shocking when you look at it in that way. So what we're trying to do is totally flip that chart around and get more cancers to the left-hand side of that chart. And trials in America and in the UK and Europe, and then pilots that have already been running in this country, in Liverpool, Manchester, and we had a small pilot in Nottingham City, shows that we can totally change this relationship around. We can achieve around 60% of cancers as early stage. And we did that in Nottingham City with a small pilot. Next slide, please. And this just shows that graph in another way. It looks at 1, 5 and 10-year survival for all of the main cancers. It's almost like a league table, if you like. So the higher up the table, the better the survival rates. And as you can see down at the bottom, lung is right down there at the bottom in terms of 1 and 5 and 10-year survival, but is one of the most prevalent cancers. Next slide, please. So the programme is aimed at those aged between 55 and 74 who have ever smoked and are registered with a GP practice in Mansfield and Ashfield. So we estimate that the target population that age range is just over 45,000. We've got a high percentage that have ever smoked. It's around 70%, which is one of the highest in the country. And we estimate that we'll be doing just over 8,500 scans. And we're planning, the modelling shows that we should be detecting just under 400 cancers, and then just over 1,000 what are called small nodules, which can turn into cancers, but it's good to pick those up at an early stage. Next slide. So the patient journey, invite letters will be going out, and they'll be going out this month for the first cohort of patients. There will initially be a telephone triage assessment and a risk assessment done for those patients, and if they're deemed to be of a certain risk, they'll come for a face-to-face lung health check. And again, if they meet the criteria, they will be offered at the same appointment a low-dose CT scan. And at the same time, all current smokers will be offered the opportunity to talk to smoking cessation advisor as part of their lung health check. And as part of the interventions, we're keen to look at offering e-cigarettes as part of that package of interventions, because latest evidence shows that e-cigarettes combined with targeted support produces the highest quit rates, and that is a key aim of this programme as well, is to improve the smoking cessation rates. Next slide. So we've worked with local authority and public health colleagues to map where the targeted population is, and you can see that on the graph here. And as you can see, it's quite a disparate population in terms of where they're going to be, where we know they're located. So a number of areas that we need to target, and because of that, we've decided to implement a community approach to the service. So some other areas, some of the pilots are concentrating the service at the hospital, but we thought because of the large geographical spread of where the targeted population is, we need to take the service out into the community. And I think particularly in light of COVID, that's even more important. People will trust this model more than going into hospitals, and we need to keep patients away from hospital wherever possible. Next slide, please. So, as I mentioned, community approach, and that will be delivered by a one-stop shop mobile facility, which will combine the CT scanner, which you can see on the left, and then attached to that CT scanner will be a modular clinic facilities that patients will have their assessment and their consultation. And these will be centred in a number of places throughout Mansfield and Ashfield. So leisure centre car parks, supermarkets, civic centres, etc. So we've got a number of those already identified, and the pilot will start in Warsop using the Shore Start Centre facility as the base. But everything will be done in the community, and as I say, in a one-stop environment. And again, we've looked at COVID and to make sure that the facility is safe for patients and for the staff. And that facility will move around the county. So as I mentioned, we expect to start, the invites are going out this month, and then the first scanning will start in Warsop in April through to May. So we're starting with what's called a soft launch. So we start with 1 or 2 practices to check that the pathway and the processes work, and then we'll pause just to review how that's gone and reflect and look at the impact. And the first round of scans will take place over 2 years, and then all participants who have their first scan will be invited for a second year follow-up. So the whole programme will take 4 to 5 years. And those that do have their cancer diagnosed, they will then go to Nottingham University hospitals to have any treatment that they require. Next slide, please. And I'll just finish with just a link to more information. So we've got a website for patients and the population, clinicians to look at, which gives an explanation of what the programme's about and patient leaflets. And then there's also some patient stories of patients that have already gone through the screening programme, their outcomes, and also an animated video is there also, which we're using as part of our comms and engagement process. So I'll pause there and take any questions.
Thank you, Simon. Any questions, please? Susan.
Thank you for the presentation. Really great to hear that you're going out into the community. The mobile unit looks fab. I'm just interested in the letter. Have you done any consultation with individuals about the style of the letter, just so that people plain, and also, will you be doing any follow-ups when all these letters go out, and some people quite rightly will either put it in the bin, won't read it, or will need following up, please? Thank you.
Yeah, sure. Good question. So both on a national level and a local level, there's been significant engagement with patients and carers to make sure that the letter is appropriate in plain English, but we've also got it converted into other languages. So, for example, Polish, which we know is a population in Mansfield and Ashfield. So, yeah, it's gone through extensive consultation, but we'll keep learning as we get more feedback on the invites. We'll potentially adjust them if we get feedback from patients that they're not quite right. And in terms of the second point, yes, patients will have an initial invite, but also be followed up with a telephone call and have a second invite. And also we're doing a big comms and engagement programme. So we're putting targeted Facebook messaging out to the local population. We'll hopefully have, we will have BBC Radio Nottingham and East Midlands News also covering the launch as well. But any feedback from you guys on how we can improve that would be most welcome. Thank you.
Thanks, Sam. Joyce, Councillor Bosnell.
Yeah, just a couple of questions, Simon.
Sure.
Sue's right that the mobile unit looks really fantastic. Question is it brand new, or is it the one that's usually parked outside Kingsmill Hospital? And then the second question is, why have you chosen the age range 55 to 74 when I would have thought that it would have been younger than 55, really? But you've probably got some rationale for that. So that's my two questions. Why that age range? And is it the same one and is it the same mobile unit or CT scan that is normally parked outside Kingsmill Hospital?
Thank you, Joyce.
No, good question. So it's a new scanner just for this programme. So both the scanner and the mobile clinic facility are brand new, and the mobile facility has been purpose built just for this programme. So we're really pleased with that, and our partners have invested significantly in new equipment and staff, which is really positive. The second question, in terms of the age range, that's guided by evidence base based on the trials that have happened in America and in the UK and Europe. So it's deemed to be the optimal range that will get the most number of cancers or be most cost effective. And Jonathan can come in and help me if I'm not explaining this right, but you could screen the whole population, but the cost effectiveness starts to diminish. So it's deemed to be the optimal range for picking up early lung cancers, but it's absolutely based on evidence of trials. It's not been plucked out of the sky. It's absolutely evidence based. I can assure you of that.
Thank you, Simon. Jonathan.
Thank you, Chair, and Simon. Thank you for your presentation. And yeah, I'm delighted that we've got that we're able to bring in something that further dents inequalities in Nottinghamshire. So I'm really pleased with that. You and I were able to have a bit of a chat a couple of weeks ago around some of this, and you did mention the big splash that you're wanting to do in terms of the launch and all of the communications that will go on around that. And in terms of addressing inequalities, I'm really keen that we can just explore how to leverage that even more in terms of some of the other prevention messages. Of course, you'll know that back in last April, just as we were hitting pandemic, we relaunched our an integrated wellbeing service in Nottinghamshire that incorporates our Stop Smoking service. And of course, there are messages that we really want to be able to get out to people right across Nottinghamshire, not just in Mansfield and Ashfield. So I wonder, as a specific thing out of this, whether we could link up our comms people and public health colleagues with you just to explore, without diluting the main messages that you'll need to be getting out, how we can also get out some really good messages about stop smoking across Nottinghamshire. Thanks.
Thanks, Jonathan. Sam.
Yeah, I'd be delighted to work with you and Jonathan. Yeah, absolutely. It's every contact counts. So while we've got this targeted population, we need to make that count. And I must also stress that this is a precursor, hopefully, for a national lung cancer screening programme. So I know there may be comments about why is this Mansfield and Ashfield only at the minute. Well, if colleagues just be patient, because we're hopeful that eventually this will become the fourth cancer screening population, which will then target the whole population. But so just wanted to stress that.
Thanks, Simon. Sarah, welcome. Sarah Collis.
Thank you. Hi, Simon. Sarah from Healthwatch. First question is a bit of clarity on the numbers that you're expecting to uncover with the screening programme. Was that for the total 2 years, or was it just for a year? I think it was 300 and something you're expecting to uncover. Sorry, just that's the clarity. And the second bit of that is obviously with an increase in cancer detection, which is be fantastic at that early stage 1, which is what we want. With the situation as a result of COVID, we've obviously had a lot of cancer patients who have not been detected and are going to be detected at a later stage anyway. And I'm just interested to understand how the capacity will be managed in terms of increase of, obviously there's the double-edged sword, the more you detect, the more you need to support, and the bigger impact it has on capacity in the NHS, but also support services in the community for those cancer patients. So just understanding the bigger picture of bringing a brilliant new screening programme. I'm absolutely in favour of it. I think it's fantastic, but just understanding the impact that that's going to have on the system in general.
Yeah, good points. Thank you. And if I take the second one first, so I think COVID has made this programme even more important because lung cancer, of all the cancers, has been impacted most by COVID. So whereas most other tumour sites, the referrals for cancer have rebounded back to 100% of pre-COVID. That's not been the case for lung. They're still at around 70% of pre-COVID levels. So we're not seeing the lung cancers that we were seeing before COVID. So this makes this even more important that we're proactive and go and look for them rather than wait for them to come in. In terms of capacity, absolutely. We're resourcing additional capacity throughout the pathway, right through from the scanning, the reading of the reports, through to theatres for any surgical cases that are needed. So there is investment going into the entirety of the pathway to ensure that we can absorb the additional cancers. But what we're doing is almost bringing those cancers forward, if you like. So it puts extra pressure on for the first couple of years, but potentially we'll see less cancers coming through 3 or 4 years down track because we've brought them forward, if that makes sense. So we have to protect services early on to be able to absorb that. But absolutely, I can assure you we are putting investment into the hospitals and community services to absorb the pressure. Did that answer all your questions?
Yeah, that's great. Thank you, Chris. Simon, sorry. Yeah.
Thank you, Sarah. Thank you, Simon. Jeremy.
No, I've had my questions answered actually. Sarah answered them very eloquently. I would just say though, just a personal observation. I had 2 members of my family. One who was, I remember being there when the information was provided about there was a stage 4 lung cancer, and another member who had a stage 1 lung cancer, and the difference in obviously the outcomes was huge. So anything that we can actually do has, huge impact on our populations, and I'll be very interested to see the results of this.
Thank you, Jeremy.
Thank you. Councillor Guilford, Glyn.
Yeah, sorry, Simon, my computer went completely out and I've had to re-log in. So I only got the latter end of the presentation, but from my point of view, I think this is for former mining communities, it's in particular a major step forward that this trial is going on. And like you've already said, there'll be other areas that will be saying, I think we need it, and I will be saying, yeah, I think we need it in Bassetlaw and many other communities who, unfortunately, being a former miner myself, I used to see could never understand why people who went down the pit for 7 1/4 hours and never had a cigarette used to then come up and smoke in the time from getting up the pit to going back to sleep, anything between 20 and 60 cigarettes, and I just don't know how they did it. And still to this day, it's unfathomable for me to do that. But it's I'm really glad that you're doing that. It also reminds me of the units that we used to have come to the mine to do chest X-rays for HUD for pneumococcosis and checking us out. And I'm just wondering if you're going to go to any particular workplaces, because again, you've got a captive audience, and you could probably work with the people at their workplace and get them as they're coming into work and as they're leaving work, or even working with the people who own the place to let them do it whilst get people to come off. and you've got a captive audience there as well. And it would, you know, so I think if there are places, you know, large workplaces in Mansfield that you could sort of turn up and say, here you are, I'm sure you would get through a lot then.
Sure. Thanks for the comments. Just to stress that it is based on an invite, so it's not. It's at the minute it's not open access that anybody can turn up. So because of the evidence base, we have to be very clear on who can be invited. So it is based on an invite. And second, we're trying to get as close to local populations as possible. The balance is that the facility is actually very large. Once it's in place, it takes up around 30 car park spaces. Wow. So we have to have good access to sites and then be able to locate it, because it is quite a sizable unit. So it does restrict us in some ways on where we can locate it safely, but we're trying to make it as local as possible and go to as many venues as possible.
Thanks, Simon. Susan.
Can I just, something's just occurred to me, following on from Jonathan's thing about comms coming together. Is it possible to check out if, when you get these people there, and sometimes it's about the demographic and, sure. You know, whether they come, about whether they've had the COVID jab or whether they've had, can you pick up anything else, or is it just purely the lung thing that you'll concentrate? Because I just think while they're there, I'm obviously you can't have a COVID jab while they're there, but just picking up any other things that might impact in their lives and health-wise.
I mean, actually, well, and actually, we've talked about whether we could provide COVID jabs. So we are trying to explore, as we're going out into the community, what other things we could do. So we are having discussions around, could it be used to mop up people who are not having, for want of a better phrase, not had the jab. So that is being explored. And yes, they will have a general health check as part of the assessment. So yes, this is targeted on lung, but that they'll be looking at weight and their lifestyle as well. So yes, it's lung is the priority, but we will be looking at some of the other general health, and we are exploring is COVID vaccination a possibility, but that's not been finalised yet. So watch this space.
Okay, great, thank you.
Thank you, Susan. Thank you, Simon. Any further questions, please? No more hands up. Thank you very much indeed, Simon. It is a good news story. I've had friends that since COVID have had lung conditions. I think part of the long COVID situation. So whether that will be rolled out into that as well. But thank you very much indeed, Simon. Excellent presentation. The recommendations are to inform the Health and Wellbeing Board about the launch in Mansfield and Ashfield, and I think the sooner we get it rolled out nationally, the better. But because the achievements, it's wonderful. So thank you very much indeed. Thank you, Simon.
Just to please, if you can publicise the programme in your local population, encourage uptake. That would be really welcome. Thank you.
I think thank you, Simon. I think we're very keen to work with you. So thank you very much indeed.
Thanks all.
So now we come to the final item on the agenda, which is the work programme. Martin, do you like to speak on the work programme?
Chairman, I think it's one for Bryony to do if she's there as your lead officer.
Are you still there, Bryony?
I am, yes. Afternoon, everybody. For those who haven't met me virtually yet, I'm Bryony, the new officer supporting the Health and Wellbeing Board. So just very quickly, a couple of things I'd like to draw to your attention in regards to the work programme. So as we've reiterated at previous meetings, the situation with COVID-19, as well as rolling out the vaccination programme from December, means that we're not currently in a position to hold the workshop that is scheduled for the 31st of March, just due to restrictions on current capacity. So therefore, the next meeting where we'll all meet as a board will be on the afternoon of Wednesday, the 9th of June. This short break from now until June is due to the local elections taking place in May, which I'm sure a number of members are well aware of, that are on the horizon. But I'd just like to take the point that this short break provides the opportunity for myself and to work with you guys as members on reviewing and organising the work programme for 2021. We do hope and plan to resume holding workshops following this break. And I'm pleased to announce that we do actually have one scheduled for July, looking into a local action plan on mental health and suicide prevention. But further details on that will be shared as we move into the planning stage of holding that workshop in July. And then, yeah, just following on from the recommendations, if members would like to comment or request any additions to the work programme, I'm happy to take that on board. And I have noted, obviously, the comments from Councillor Guilfoyle about an update on the Community Champions funding and the progress on that initiative, as well as Councillor Bosniak's point about a bit more information on how we're engaging with Syrian communities in other districts as well.
Thank you, Bridie. And thank you, Tina, Alan and Simon, for their presentations today. They've been very good. And thank you all for attending. Oh, Jeremy, would you like to say a few words?
Yeah, I'm just conscious of the fact that the Health and Wellbeing Board strategy is until 2022. I presume that's until April 2022. And I guess what I would like to understand is whether there will be an opportunity to review or what the thinking is about how the members might look at what is being potentially proposed for the next 4 years. Particularly when there has been the integration proposal, the integration and innovation programme for joining health and social care close together, which again is due to start in 2022. So I guess it's just to firm that up a little bit and understand. And I presume Jonathan will have something to say.
He certainly has. Thank you, Jeremy. Yes, it's Jonathan.
Yeah, I can speak to that briefly. So you're quite right, Jeremy. The Health and Wellbeing Board has a statutory duty around promoting integration. So I think taking a look at that would absolutely be a very appropriate thing for us, for the board to be taking a look at after it reconvenes in the summer. In terms of the joint health and wellbeing strategy, you're right, that runs to 22. There's no month date on that, so we don't need to tie ourselves to having a refreshed and new strategy in place for the 1st of April 2022. Nevertheless, once we can move from a position in public health of being largely in response mode and get back into something that looks like recovery and towards business as usual, it'd absolutely be a priority to be working with partners, and in particular our local NHS partners, to be starting to develop that joint health and wellbeing strategy. So that will also be something which board members will wish to input to probably later on this calendar year. So thank you for that. We can get it on, make sure it's on the forward plan. Thank you.
Thank you, Jonathan. Thank you, Jeremy. And thank you all for the input. Thank you very much indeed for attending. Take care. Bye-bye.
Thank you, Chair.